This video will talk about space regainers. So, space regainers is a procedure which is carried out during interceptive orthodontics in order to anticipate the potential irregularities that might be present in the malocclusion and to correct them. So, they are divided into two types, fixed and removable. So, to remember the fixed one, we must remember a mnemonic Hall gas. By H, we have Herbst appliance. By O, we have open coil spring appliance, which is another name of Herb's appliance. By H, we can also talk about Hall's lingual arch appliance. By G, we have Gerber's appliance. By A, we have anterior coil spring appliance. By S, we have sectional anterior appliance. To remember removable, you must remember Juffs with double S. So by J, we have jack screw. By F, we have fixed loop space regainer. By S, we have saddle split space regainer. And by another S, we have slingshot space regainer appliance. In fixed by L, we have lip bumper as well. Now, starting from the first one, which is Gerber's space regainer. To remember this appliance, you must remember that it is a unit which has a U unit class assembly. Then we have U shaped stainless steel wire. And at third, we have the tubing. Now, suppose this is the space that we need to regain. Now, in this, what we do is we have a U-shaped assembly around which the U-shaped stainless steel wire is attached, and we activate the appliance. By activating the appliance, the coil basically pushes the to distally, so space is regained. But however, if we use it in passive form, it will act as a space maintainer. Now, coming on to the jack screw. In jack screw, what you will see is there is going to be a split present over here such that it will have the coil springs as well as a split in the distal side to regain the space. In cantilever spring, we will see that there is a finger spring on the most distal tooth like this, and we will have the coil in anteriors as well. Now coming on to the lingual Holt's lingual arch. In this, suppose you have a missing tooth here. So basically, there is a U-shaped coil, and by activating this coil, we allow the space by distalizing the teeth, and which leads to the erupting premolar to come into the space that is regained through it. Now, lip bumper. Lip bumper is something like this, and it is attached with a spring onto the molars. Now, in this, what happens is when first of all, you must remember that around the lip there is a blanket of muscles. Now, when distal force is applied by the lip muscles onto the molar, so this spring causes the distalization of these molars, due to which there is a space created between the molar and the primary teeth, and which leads to the space for eruption of the premolars. Now, in this also there is the major role of lip muscle. We also discuss about lip muscle during myofunctional appliances. So now in this, what we will do is we will install a lip bumper, a spring, and it will be attached to the first molar. Now distal driveway force is applied. All right. Now, in one more, there is Herbst appliance. This is similar to the Gerber's appliance. In this also we have a coil U-shaped spring, which when activated it causes a distal force and then it leads to the eruption of the tooth. Now over here, another form of space regainer is something like this. Now this is used to regain the space. These are split saddle space regainer, and something like this. In this, a post helical spring of 0.7 mm is given. Over here for split saddle, what you will see is a dumbbell shaped, something like this coil of spring will be present. So it is 3 mm wide, allows cutting of acrylic with a separating disc.